I'm so delighted that there's some familiar faces on this call here. For folks I don't know, my name's Jessica Perlow. I've just started at the foundation. I'm 28 days in now, and I'm so grateful to be here. Daniel Wolfson, the former EVP of the foundation, he left me many gifts in this role, but one of them is that he teed up our guest today, who just so happens to be an old colleague of mine, and the best possible speaker I can imagine on this topic of trust. Shoma has been fostering trust in communities and in relationships for years. She's an expert in co-creation, equity, and trust, among other things. But before we circle back to how we met, Shoma, can you tell us a little bit about your background and your journey into this work?
Jess, first of all, I just wanted to say how delighted I am to be here as you step into this role and to be on this in this dialogue with you. It's just a delight. So my journey here takes me to, oh gosh, it makes me feel old to say this, but about a quarter century of walking alongside people in communities, first as just a community member, then as a public health professional working globally and locally, as a primary care clinician in the safety net at Cambridge Health Alliance, over to IHI, leading 100 million, walking with hundreds of communities across the globe, and now at Wellbeing and Equity in the World, where we continue that journey. And it's just been such a rich journey that's taught us so much about what it looks like to have trust and equity and abundance.
Yeah, yeah, very much so. And you're a very busy woman, so we're very grateful you were able to make time for us today. So, um, we met in 2014 when you came to the Institute for Healthcare Improvement, as you mentioned, and led 100 million healthier lives. And at the time, you really transformed the culture at IHI and the way we thought about co creation and engaging across silos and fostering health and well being. Can you tell us a little bit about 100 million, what it was, and how that effort laid the groundwork for your thinking about trust?
You know, throughout my personal journey, one thing I knew was that the people who were closest to the problems had a lot of the solutions to offer. And yet, what I noticed was that we often created solutions without the voices, the leadership, and we say the pieces of the puzzle that those who experience poor health and well being, who experience inequities every day, were missing. And it didn't mean other people didn't have other pieces of the puzzle. But what we knew as we started 100 million, we'd just come to the recognition that the social determinants were driving health outcomes. We could see the difference. We'd been at IHI on a safety journey, and yet we were seeing even in hospitals, safety cases were of poor safety was on a lack of safety was on the rise, and in our communities, we were seeing maps where there were kids born in the same hospital who'd grow up 2 miles apart with a 25-year gap in their life expectancy. And we would see that in community after community. And as you know, Jess, whenever we see something replicated, it over and over, it tells us that there is a system in place. And what we knew for certain was that we didn't have the answer. So 100 million wasn't about us coming up with the answers and telling others to trust us. It was about trusting that collectively we could have the pieces of the puzzle, that if we created the conditions for community members and people who could be facilitative leaders, people across sectors and housing and food and farmers and barbers, if we all got together, we might just have the answers together that we needed
Mm.
to improve health and well-being and skill.
Yeah, the system was perfectly designed for inequity, and I love the approach similar to what Marshall Gantz says, where you're creating space for the people with the problem to be the authors of its solution, and that's very much it felt like the way you were approaching that work. So 100 million concluded in 2020, and it subsequently gave rise to the establishment of We in the World, which aims to address these broader issues of inequity beyond the realm of healthcare. So, can you tell us a little bit more about We in the World?
Absolutely. So in 100 million, what we were able to see was that, in fact, it was absolutely possible to reverse Black white disparities in maternal mortality outcomes. Communities had done that. It was possible to reduce youth reincarceration by 96%. It was possible to improve childhood obesity by 50%. And it was possible to end homelessness in communities. The issues weren't that it wasn't possible or that the solutions weren't there. The challenge was our collective will and the
Mm.
presence of a system that was perpetuating inequities and the disconnectedness of the system. So we started We in the World with the idea of what if we could take what we had learned in 100 million from communities all across the world, and figured out how to bring the collective together that could help make these a new norm,
Mm.
that could help address both the systemic inequities that were setting up people. So you could take people and improve their lives, but if they're fighting against a system that harms them or doesn't work for them, they will reliably fall through those. So here at We in the World, it was really about, could we actually figure out how to change the system? How could we help grow many people who knew how to change the system? And collectively, could we show that we can create a nation that, in a world that in which people can improve long-term health and well-being?
Yeah, I mean, that's incredibly audacious. And so I'll ask you to talk to us more about some of how you do that. But specifically, I'm wondering, how do you approach trust in that work, and why is it important for healthier lives and equity?
Well, we knew that trust is, Hannah Sherman, who is the former leader of health at the Center for Courage and Renewal, said that trust is efficient. And
Mm.
what we've seen all across every part of our work is that trust enables people to offer what's happening in their lives in our exam rooms and in our reading rooms. It offers people to share solutions that they might have. Oh,
We can hear
Uh,
you now.
okay. And trust offers a way for people to be willing to put their assets together in the commons in a way that they wouldn't.
Mm.
But to have trust and to give trust, conditions have to be in place that makes that's both interpersonally, where things feel trustworthy, where the conditions for trust are in place in the process, and an understanding of what has um, diminished, undermined, or broken trust is able to be acknowledged, owned, and healed. And I
Mm.
think it's that understanding that, um, what we can do together when in those conditions, and what's possible. I think as the pandemic happened, we had to, we started off doing things like, what does it look like to build trust in places like Delaware in a way that shifts mental health and addiction outcomes in a way that trusts those youth experiencing homelessness and people who are peers coming out of prisons to be trustworthy messengers, all the way to, in a way that reduced statewide overdose outcomes, while every other state in the country went up by 23%, in 2020 in the context of the pandemic, and what it meant for systems to be trustworthy to people in that context. So that, so it's an understanding of that too. Then in the context of the pandemic, as we saw the communities of color, communities in poverty being the greatest hit, seeing the resources going to the opposite places in our maps where the death rates and cases were, what we realized was that we needed to build a trust-based system to move the money into communities, to
Mm.
trust those who, wasn't about asking for trust, it was about giving trust and being trustworthy, of
Mm.
supporting those who are closest to the problems to lead the solutions. And as we were able to do that, we were able to actually watch in over 500 communities around the country what happened, how creatively people solved real problems, improved hundreds of thousands of real lives of their friends, their neighbors in the most creative and brilliant ways, and found ways to build systems that could not just create 5,000 jobs today, but create and shift policies like Medicaid expansion in North Carolina, shift the Farm Bill, shift what happens with broadband policies and the conditions that lead to poor health for the long term.
It's just incredible. And it seems like a part of your approach is establishing these meaningful connections, and they're intentional and they're really about power. Ultimately, you're talking about shifting power, and making really effective change. But I'm wondering, like, how do we start? So can you shed some light into what your methodology is for initiating and nurturing these connections? How do we start to get to these incredible outcomes?
Well, there's if you go to publichealthequity.org, we actually wrote up some of that and developed for the CDC a health equity framework that's being used across public health departments now across the nation. But it begins by getting in relationship and doing things like mapping trust. So we actually have processes to not both map power, but also understanding that trust is a form of power. It's in
Mm,
fact a superpower to map who has trust and to invite and get in trustworthy relationship. And that
mm,
often starts not by asking for something, but by listening, by understanding of, by grounding ourselves and then building trustworthy relationships. So in our case, we were forming relationships with an organization of 10,000 Black artists, activists. And I remember going to Abini Bloodworth, the founder of that organization, who I had helped in a prior piece. And I remember saying, Abini, I'm really worried. I'm watching where all of the deaths and cases are, and I'm seeing vaccine hesitancy in Black and Brown communities. And I don't know what to do about it. And she said, Shoma, I don't know that I trust the vaccine. The healthcare system hasn't served me or my family. And she told me all the stories. And then there were just question after question. And so the first few peace times that we talked, it was just these deep dives into acknowledging that, in fact, we had not served people well. And not only had we not served people well, as a misservice or where we just didn't do something, we had harmed people. And, for her sharing that I know and understand that, in my community, there were forced sterilization campaigns in the name of population health. And she could say, oh, and that had happened in hospitals in our area right here where we live. And our ability to talk about that openly and honestly, and then to say, what is it? Why do we think it's different? And at the end of the day, at the end of the conversation, she wasn't ready to say, I trust big pharma, I don't trust hospitals. She said, but I trust you and we're willing to work with you. And for us, as we then brought together, we actually mapped who had reach and who had trust, formed a partnership across 10,000 Black artist activists, all of the Indigenous leadership in the country, the Migrant Clinicians Network, Latino Health Access, Meals on Wheels. Like we really mapped who had trust and brought and knit them together. A lot of what that required was for us to say, how do we create trustworthy conditions in a moment where we don't know what the safety profiles are? We know what the tests are, but we don't know for real. And so, in Chromatic Black's case, they created a campaign called Keep Black Love Alive that was based not because they knew, they said they were going to be neutral, but they were going to give the vaccines and they were going to make it possible and they were going to give the information available to communities. But they were also going to create a storytelling, story catching campaign so that if something went wrong, they had a mechanism to know what that was. And of course, what they also caught in that campaign were all the stories of meals enjoyed and lives saved and people who did well. And I think that understanding that this was going to be first and foremost an effort to build and maintain trust, that things like data belong to communities first and needed to build and report and be accountable to them. Those were all critical things that we needed to build to do that.
I mean, I shouldn't be surprised by this, but it starts with us in being trustworthy. And yes, Harv Heller is saying, listen to the stories, which it sounds like, you were very much doing and is a part of how you use data and honor people's stories. And you sort of already answered this, but um, interpersonal trust is sort of a commonly understood concept, but this development of systemic trust is uniquely challenging to folks. And so can you go a little deeper there into some strategies and approaches for cultivating trust at a systemic level?
Yeah, I'm happy to do that. You know, we also say stories are data, Jess. And so we actually have a process of partnering with communities and trusted messengers to collect stories. And I've built a methodology called Stories to System Change because every story of equity or inequity encodes a story of the system and tells us that it turns out 7 stories give you something like 90% of the data because stories are much richer, especially when they're not prompted in a particular direction. That was what helped us realize that, for example, the problem of mental health and addictions began. Yes, it was in the current population of people experiencing homelessness in Delaware, but actually began with school discipline policies. So you can begin to map where those are and then begin to say, what does it look like to actually build a trustworthy system? So in Delaware, as we realized that, as just one example, um, we realized that it was first school disciplinary policies where kids would be suspended. And as a result of those suspensions, they would miss more school. They would be back in school. They would come back to school, be more unprepared, and end up in more trouble. And if
Yeah.
there was a school resource officer in place, things were much worse. So, we looked at data in a way that was about validating and trusting what communities were telling us, and
Mm.
about and looking for that. As we lead the federal non-federal process for measurement of population and community health called the WIN measures, and big part of how we've been ahead of the curve there has been by listening to what communities tell us and watching as the data shows through
Believing
multiple
them.
researchers, right?
Yeah.
Believing them, saying, well, how could you measure things like loneliness and purpose and meaning and disconnection, trust in police, experiences of discrimination, and watching the research follow
Mm.
that. But the other part, as we saw that kids were falling apart in the foster care system, we were able to do something where we brought together uh, everybody who was involved: foster care, juvie, um, social services, adult mental health services, child mental health services, Medicaid, and others around a table, along with caseworkers and youth who are transitioning from childhood to adulthood, because we trust kids to be deserving and we don't believe adults are deserving of support. And so, and we literally were creating the homelessness and cycle of who was ending up in our high risk, high cost groups. And so as we did that, every child's story, every became a plan, do, study, act cycle where we could map the system, we could say what was needed. If we were to build a system that would support this child to have their best possible chance of well-being, what would that be? And we realized that system needed to be built from 2 years before to assure that they had access to either career education, a home, a support system, and all of the rest of what's needed to assure well-being. And then with each child that was transitioning, we would say, where is the system failing them? How do we create the policy exceptions today? And then how do we use the policy exceptions to change the policies in the long run? And I think that ability to get really clear about what we're talking about, to get really practical. Sometimes we think very theoretically about these things, but in the case of Delaware, we had to figure out how to transition youth in a way that shifted policies and systems. In the case of Communities Rise Together, it was about changing and bending the federal pipeline of money to the place people who needed it, and trusting and supporting those communities to be able to mount and lead their own response. And that took $30 million of funds into those communities to create the jobs. And I think part of what we were able to show is that trust was efficient. Trust could achieve real abundance, like it could actually shift the needle, um, and do that in a way where now I think 53 federal agencies are using frameworks developed and contributed to by communities that said what was needed.
That is just incredible. And you're giving us a picture for how you systematize trust at We in the World, from how you use data to how you make sure you trust both qualitative and quantitative data, and how you leverage that to make really, truly meaningful change that matters to the people you serve. Um, and I'm wondering, outside of We in the World, you're also a clinician. And so, what does it mean for a health system to be trustworthy? What does that look like?
Oh gosh, that's such a big question, Jess. So we've been thinking a lot about that. Both I've been thinking about that both as a primary care doctor, as a health system improver, et cetera, in our work, and thinking about how you build equitable health systems. And more recently, Robert Wood Johnson Foundation has asked us to lead up a national program office to address structural racism in healthcare. And as we've been doing that work in partnership with communities across the country and with health systems, and patients and community members helping to define that, here are the things that we found. One, we need to shift ourselves. If we go into a conversation thinking that we've got it all right, we have it all figured out, and that we haven't created harm, then we're kidding ourselves. Like we can't even begin to get started. And it doesn't mean we actually spend a lot of our time in joy. So I want to say that we talk about heavy things, but in ways that are about freeing ourselves from legacies that have weighed us down, and collectively removing and transforming those legacies in a way that creates abundance and joy. And so I think that that's really important, for people to understand and be able to consider living into. Structural racism in healthcare is real. Interpersonal racism in healthcare is real. And I think that while we can certainly look at the data of who's gotten pain medicines, et cetera, or not, in waiting rooms, but even more than that, whether we accept Medicaid or not, the fact that we had for colored only waiting rooms, that I mean, if we don't understand how we have mistreated people, we still have a segregated system of medicine. And I think until we can wrap our minds around the fact that we may have all gone into this to be good, to do good, but we are all still caught in a system that had its basis in segregation. We can't talk openly or honestly or diagnose the problem accurately. As a doctor, that's the best I can put it. Like it's just a faulty diagnosis of the system if we don't understand the contribution of how our legacies of racism, classism, the way we treat people who are in poverty, with mental illness, with gender, and like if we don't understand how that affects outcomes, and how that affects people, we can't actually move the outcomes. We also exhaust ourselves trying to educate people one person at a time, instead of understanding that actually that kid is born in a hospital. If I can predict at birth that they'll have a 25-year difference in life expectancy based on the community they're growing up in, we actually, I can't educate, we can't educate our way out of that. We can do the best we can. At Cambridge Health Alliance, we created high functioning teams, grew medical assistants and receptionists who could be quality improvement leaders and relational caregivers and nurses. We built an entire health system that was about having trust and relate. We called it love and system change. That it was that made love and trust property of the system and made the relationship the priority. And as we did that, we found that we could move health outcomes to the national 90th percentile while taking 10% of cost out of the system. But what we also know was that we couldn't do that. And that's based on a Commonwealth Fund evaluation that actually found that it was 15% if you compared to match controls where things were going up. But what we couldn't address just by doing things in our waiting room was that there was a whole set of other solutions that actually required us to get in relationship with people and places that invited us to think differently and gave us many more assets to work with beyond what we had in our waiting rooms. That we were actually far more powerful than we had given ourselves credit for. And if we could figure, if we built those relationships, we could actually find not only that, for example, uh, kids spend a lot more time in schools and schools could be great partners in the work, and that there were many more assets in the community, but also that there were more that it was more efficient to solve problems there. It was more efficient to understand that we had choices about where we hire people from, and where we purchase from, how we build small businesses and buy food from in our hospitals, and that suddenly there were all these other partners in the healthcare team that could become part of actually bending the curve of health inequities in the first place, that could restore and greenline places that had been redlined so that that community had the tax base for good schools and for healthy parks, and that toxic stress could be reduced. We actually could put the supports in place as a health system in Texas did to imagine what it would look like to interrupt the cycle of generational poverty. We could trust community members and families to propose supports for their own lives, and solutions for their own lives through resources rather than trying to solve it for them. And we could use our policy and lobbying power and our narrative power through our comms departments to change the narrative about why people are poor, why people experience inequities, and to move policies that aren't just about our payment, but to shift the and bring our power and uh, privilege as health systems, which is considerable, to do things like interrupt the incarceration pipeline and to change contracts between jails and for-profit prisons and police departments that actually incentivize police to do bed fill rates of 90%. And it's our ability to say that we actually aren't powerless, that we can be trustworthy to our communities. That's actually what we learned interrupts most efficiently that cycle in a way that we don't exhaust our resources, don't all collectively run out of resources, and that we can not only be trustworthy, we can trust others to have solutions that we need.
It's just incredible, Shoma. Clearly, you have an abundance mindset when it comes to tackling these long-standing, systemic, massive issues like poverty and racism and inequity and policy. I mean, you've tackled some giants here. And so I'm thinking about our audience. I'm watching faces of people who are highly engaged here, and it's compelling me to want to remove the spotlight from us and do a gallery view and open up
That
for a dialogue. Is that all right with you? Can we do it a little differently right now? Because um, I realize that folks on the line are probably coming at this from all different angles. And so it might be helpful just to open it up a bit. We already have questions coming up in the chat, but let's do that. Let's shift. If I can ask Jamie for your help, moving us into a gallery view, and let's just have a little roundtable here.
I love that.
And feel free to come on video if you'd like, or you can remain off if you've had enough of looking at screens today.
Put
Any
on my
questions?
glasses.
Yeah, you might need them now. Jamie, as we were talking, I wasn't monitoring the chat. Did any questions already come up?
Yeah, we have a few questions. So the first one, Shoma, have you ever taken a calculated risk to build trust and achieve impact? And if so, can you share what that outcome was? And was it worth it?
Oh, easily. So I mentioned the story for, I mean, many. It's hard to ask for trust if you're not willing to trust, right? So an example of that was when I mentioned that Beanie Bloodworth and Chromatic Black, the 10,000 Black artist activists that weren't at all sure that they trusted the vaccines, trusting them to so we got $11.5 million from HRSA, and that's a whole other story of how we got there. But trusting them with actually a fifth of that to lead the response, without getting in the middle of that. If we hadn't done that, Keep Black Joy, Black Love Alive wouldn't be born, wouldn't be today holding town halls about how we support organ transplantations and shift mindsets about that in communities of color. Like uh, Black Voters Matter wouldn't care about the funding of public health infrastructure in rural Georgia. I mean, there's just this uh, incredible outpouring of what happened in the context of trust. The other thing that happened was as resources shrank, people were abundant in offering support to one another. So, uh, when you hold resources in a way that's trustworthy and everyone steps forward and says, here's what we can do, we have something to share. That's what we've seen in communities rise together. So I'm abundant because I'm part of whole communities that are unspeakably abundant with each other.
So definitely worth the risk for those outcomes. And Tina
Yes.
asked, and I had the same thought when you shared the stat about 90% fill rate incentives for police. She asked if you could provide the source, but also can you share a little bit more about that? Because like I said, I had never heard of that before.
Yeah, so one of for-profit prisons actually create their bed allocations based on third grade reading level. Again, the presence of a system. And if you follow that further, what you see is that those prisons use labor from large corporations where we're paying $1.10 an hour versus minimum wage or certainly a living wage for the same goods and services. So there's a whole economic engine. In Brooklyn, for example, there are 8 neighborhoods that are responsible for the vast majority of incarcerations. They're feeders. And so in those places, what you see is policies and incentives in place. So there are several sources I could point you to. ACLU.org had a really nice data tracker for a while that could show you what public policies are in place, but also other policies, Just Mercy and the Equal Justice Initiative. So there are a number of groups that are working with this. I think one of our pieces, Jess, has not just been working with communities, but actually working with in building an entire ecosystem of groups who are truly diverse, from businesses that are working on this to community groups to health systems to public health agencies to barbers and farmers who all have a different piece of the puzzle.
Thank you for that explanation. And Tina, I encourage you to join the dialogue and ask this question, but you had another one, which is, do you see your framework, Shoma, being useful for national human service networks?
Yes, actually, they've been used by a number of them. So, publichealthequity.org, if you go to weintheworld.org and you go to resources, can drop a link into the chat for you all. You'll see resources for a wide range of sectors. So, one of the things we learned is that having things by sector really helps. Pathways to population. So there's everything from how do you interrupt a school to prison pipeline to how do you create health systems that are just in that mix. Pathways to population health equity was one that it just took off. Like we began it in at IHI in 100 million as a way of helping healthcare and public health and communities that come together to understand the well-being of people, the well-being of places, and equity and racial justice go hand in hand. But what you see, yeah, if you click on any one of those bubbles, you can see lots of things. And if you go down a little bit on the page, you can search things and see spotlight resources from trend bending policies for advancing racial justice written with groups around the country to a Surgeon General's report or two about how businesses can improve health and well-being. And one resource that I'd encourage you to look at is Springboard, which brought together major groups across the country to say what are immediate things we could do now and what are pivotal long-term moves we could make today that would bend the curve in the long run. But because Pathways to Population Health Equity said, how can we improve mental, physical, social, and spiritual well-being? Human service organizations could really relate to that. Health systems could relate to that. But the other part of it was how do you improve community conditions and root causes? So faith communities could see their role, community groups could see their role, public health could see their role. Those working on upstream things like equitable democracy and others could see their role.
While you're talking about resources, Shoma, Gail is asking about stories, which you spoke about, and do you have a formalized way to collect and analyze these stories?
We do. It's called Stories to System Change, and it's something that we're actually in the midst of writing up and putting as a resource. So I encourage you, if you're interested, to sign up to stay in touch with us, and we'll get that out to you. There's
Great.
also a Win Digest that you can sign up for, which is for all things. If you're really interested in advancing intergenerational well-being and equity, you can go there. I'll put that link in as well.
Thank you so much for that. And while we're on this topic, Kim is asking, how can small community-based organizations partner with community members to build a positive culture of health?
Oh, that's, I would say if you're community-based, start by understanding who has trust in the community and form relationships with the people who have trust. Spend some time getting to know them. We are in relationship with, I've peeled potatoes in tiny little churches in Canada, North Carolina. At the time that I was doing it, they were ranked 100 out of 100 in health outcomes, and now have been slowly climbing the rankings in a faith community and farm. And it's all about relationships. To youth in Wisconsin, to people who are experiencing and graduates of the foster care system in San Bernardino. A big part of it is getting out of our offices and rooms or asking people to come to us and saying, how do we go to where people are? One thing Teal Van Lannon says is get proximate to the pain. And I would say if you can get proximate to either the pain or the joy, you found a place to connect.
I mean, I hear this a lot too, how to engage with the community in a way that isn't tokenized or maybe even through formal channels. And I wonder the extent to which you've leveraged the workforce.
Yeah, I think that so I think our workforce can be a source for that. And so if you read the Win with Business Brief, say so start with the bottom quarter of earners in your workforce and listen and create the conditions to be able to listen. But you have to set it up where that's their only role, then not to represent all of their professional hats. Number two, it has to feel safe for people to be able to do that. Number three, it should be compensated. Like you can't have people do that, after hours when they already have many things to do. But I think that ability to then, one of the things that I think has really helped us is for any listening process, we have a like, what did we hear? And reflect back, like, process for community members to both define the questions and the understand the answers together, but also then to be able to say, we say what, so what, and then now what. So, so what are the implications of this that community members have said to us? And then now what is, so what are we going to do about it?
Yeah.
And I think
Yeah.
that's an essential piece to, build any trustworthy process around.
To do what you say you're going to do after you've created the space for listening.
And if you really have courage, have governance of community members to see, are you doing the right thing? Did we actually do what we said we were going to do?
You're getting some nods here, Harv. I want to put you on the spot if I can, because Harv Heller, you put in the chat, bring them to the table and listen. And I think sometimes it's easier said than done. There are probably practices and specific ways to do this well. So can I ask, actually, Harv, could you come off mute and tell us a little more about your experience there?
My experience in my lifetime in health education, science education after college, being a practicing and dentist, and had to retire many years ago due to a disability, and continue to stay in the field of dentistry through attending local and supporting nationwide programs. But bringing them to the table as a member in Philadelphia, member for about 3 or 4 years, a PFAC member, just having medical professionals and not the people being served at the table is just bouncing off the walls.
Yeah.
I moved my wife and I retired in New Jersey, and I joined the PFAC at the local hospital because they were looking to start a PFAC. They interviewed me and said, Harvey, teach us how to run a PFAC. I said, this is your ball game. And look around the table. Who's here? Me, one of the board of trustees of the hospital. These aren't the community members that I know live around the hospital or So bringing those to the table goes with the patient voice, the community voice. I was involved once in a webinar where I think it was in Baltimore. One of the community members said, listen, if I'm going to be giving you the data for your research, and I think it was said, compensate. He said to me, not to me, but he said on the webinar, compensate me as if I was a research. Not a cup of coffee, but compensate me. And I'm saying, yes, this guy is right. And through some of the other advocacy work that I've done, compensation has come up numerous times. So it's difficult. If you're a single mom and you need a babysitter and you don't have transportation to come to the table, well, these topics were brought up, and we have to get these people in the community to speak.
And it sounds like, Shoma, thank you for that, Harv. Hearing you speak, you're doing a lot of not bringing people to you, but going to them. That sounds like a big part of how you've approached change. Is that correct?
Yes. I think that when we bring people to our tables, the balance of power remains with us, and trust is harder. So always say, consider leaving your conference table and get to a kitchen table if you really want to know what's going on, or peel some potatoes somewhere and hear the stories of what's happening, or volunteer with youth and hear what's happening in the community.
You've
You'll
had so
find-
many good one-liners here, Shoma. They're so good. Sorry, what were you going to say?
Oh no, I don't mean that there's never room or time where we do something different. Right. So there's a process that we began in 100 million called Action Labs that we really refined to called Equity Action Labs, where we bring communities together. Usually we still don't bring them into our context. We keep things in community context if possible, but where communities then come together to say, what would it take for us to actually change the system? How do we align the assets we have? What could we do in 90 days? So there are times that I don't mean everything is accomplished at the kitchen table, but that's where trust can begin, where we can begin to listen, not just speak, and where as we then take that into what does the stories to system change look like, and invite the community into sense making and system change, we then begin to have processes in place. So this whole this Saturday, there's an equity action lab in Alton, Illinois, that's about addressing school violence in the community. And there's another one that I can think of them all across the country that are happening as community members realize they have what they need to change the system.
You have a question here. Thank you for that. From Randy Pito. I'm wondering, Randy, do you mind coming off mute and sharing? If not, I'm happy to read it.
I'm having a bad hair day, so I'll speak without a picture. Jessica is kind enough to involve me in some of her previous work on joy and meaning in the workplace. So I'm really fascinated by your emphasis on joy and abundance. And I'm making an oversimplified case that the blue states may arguably have a little bit better sense of approaching problems from a sense of abundance. So you mentioned Delaware, typical blue state. Do you have any red state large projects that have succeeded on the basis of what you're trying to accomplish?
Absolutely. And in fact, have done amazing work. And so we actually work all across the country, mostly focused on red states in the quote unquote, which is where the inequities were also. So that was why we focused. We're just clear, where do we need to focus to create the greatest well-being? And so in the south of Texas, for example, there is a health system, Methodist Healthcare Ministries, that said that they really wanted to think about how to invest in creating generational change. They looked at the 25 years of impact that they'd had, and they had done so many events, that community fairs, etc., but it hadn't bent the curve. And so they became interested in what would it take to achieve real impact. And the first thing they did was they had to change their philanthropy practices to go from, doing small bits here and there that were more reactive or addressing disasters alone, to say how much of this can go shift toward building civic capacity. And so they began putting coalitions together. They went on their own internal journey around racism and equity. It was not easy in the south of Texas to do that. And then they got to practical solutions. What could they do using things like anchor strategies as they looked at how they were spending their money, where they were hiring or purchasing, to what policies there were, to what opportunities there were. And then we built for them, for example, a simulation for what would have the greatest impact. And it turned out that broadband was one of the things that would have the greatest impact, along with building and investing in civic capacity, along with policies to shift generational poverty. And so one of the things they did was begin to look at how they set aside a part of their resources to be able to actually move the money. So I would say one of the things health systems can do immediately, besides acknowledging harm that they may have caused, not just to an individual, but to whole communities or to whole groups, is to really understand how 50% of bankruptcies in the country come from medical debt, that we are every day sending people to collections in a way that destroys their credit, makes it harder for them to have other money, et cetera. And so um, in the case of Methodist, a simple thing that they did was look at the zip codes that had the poorest outcomes and stop sending bills to those zip codes. They weren't getting a lot of collections anyways. They just stopped sending the bills. It was actually cheaper for them and much better for the people. So not even don't send them to collections, just no bills. And then the second thing they did in those was to begin to invest in that community capacity. And then the third thing they did, and if you go to that Win Network site, we'd had through a listening process and an environmental scan, identified 150 policies to build an equitable well-being economy. And they began looking at using their policy levers to look at the 20,000 bills that were coming before the Texas legislature every day to say, how could they use their system power to do something different? They sent millions of dollars to join community coalitions to invest in things like broadband and are actively working with their communities to chart things like simple, practical solutions around how to support grandmothers who are taking care of their kids, turning their exam rooms into medical legal to have medical legal supports so that their clinics and their health systems could address the legal concerns that many people crossing the border had, and that was a barrier to poverty and well-being, but could also connect them with things like an earned income tax credit. So really understanding that they had many more levers than they had ever imagined. And as they looked, they found that there were people working in the superintendent of schools was doing amazing things to build integrated school districts. And so they worked and they partnered to do that. They realized they didn't have to be even particularly brilliant. They just had to partner with other people. But it was that trustworthiness and stewardship and investment for the long term in building generational change, in trusting themselves to have something that they could do, and their willingness to know that they hadn't necessarily been there before, that in the south of Texas they had created, that there had been a great deal of harm, but that they could own that history, and in owning that history could join with others to be the ancestors that transformed that history.
I mean, from no bills to the zip code, get out from behind the desk and get to the kitchen table, and trust is efficient. These were like just three things that I'm taking away of many lessons from what you shared with us over the last 50 minutes. And to close this out, I'm wondering if you can tell us how folks can get connected with We in the World.
Oh gosh, come visit our website. I'm happy to drop in my email as well. We would love to have you. Our name literally, it's well-being and equity in the world, but it's we in the world because we don't believe anyone creates change alone. And we would love to hear how you're learning to create change.